Hello, Instagram friends. Welcome to another episode of Learn with Flo. Happy Monday. Hopefully everybody had an awesome weekend. I hear that most places right now are complaining of the heat and humidity like I am, so no comments on the hair. We're just moving right along with things, right? So I love, like I said, this time to be able to get together with you guys live every Monday and really jump into some hot topics. I get inspired a lot by DMs that I get. I get inspired by current client conversations and overall just things that come across my plate. And so I use this platform as a longer form way for us to talk about it, right? For us to really be able to come to this world of healthcare and really debunk a lot of myths and to really just tell it like it is, right? And talk about pertinent and relevant topics that really matter to you guys and get the most out of it. So if you guys have been following me for the last few weeks, we've gotten a chance to do our functional interpretation series where we really got to opportunity to take a look at a in-depth lab analysis, right? I get that quite a bit of individuals that have either gotten labs from their primary care provider or a doctor because maybe they're struggling with chronic health symptoms, they're struggling with fatigue, or they're struggling with weight loss resistance, they're struggling with hair loss, they're struggling with menstrual cycle issues, infertility, they're struggling with skin issues, gut dysbiosis and GI distress, like all sorts of things. And they're like, I know something's not right, right? But then they may go to their primary care or their doctor and get labs run and told everything's normal, come back next year, or not really get a whole lot of help with that. So we got a chance to really take 4 weeks. If you missed any of those functional lab interpretation series, I encourage you to go back and rewatch and catch up on those because I got very specific about the different functional reference ranges that I'm looking for, exactly how to interpret and what we're looking at when we're looking at a basic blood work panel, right? Now, by no means is that the most in-depth analysis that we can get. Blood work, I would say, is like our starting point, and we'll talk about that today as we start to really dive into this blood work conversation into what I wanted to kind of cap us off with is how to spot a scam in the functional medicine space. And this was brought to light mostly because of some great conversations I've had with individuals like, okay, when you run blood work for individuals as part of your functional wellness consult, if you find that something is off, like, what are your treatment strategies? What do you help with? Do you just send them to their doctor for medication? And I'm like, haha, like that's a perfect segue into, okay, we have these labs and now what do we do with them, right? And that's where you're going to get a very different approach from more of like an allopathic traditional medicine model to more of a holistic functional minded model. And what we're going to actually do when we see these labs and what our treatment strategy is going to be going forward. So I get quite a few questions from individuals on how what I do, like how is it different than their primary care provider, or how is it different than their OB-GYN, and also how it's different than like other functional providers or other programs that maybe they've done in the past or have done before. And these questions are 100% valid. I welcome them. I think they're super understandable because we have been conditioned as a society to believe that we have to outsource our health to someone or something else, right? As if like we don't have like a really strong intuitive approach to how to care for our health. And this conditioning kind of leaves us feeling, very vulnerable, feeling out of control of our symptoms and our health outcomes. And I will say that especially in this, call it functional wellness space, there's a lot of people taking advantage of that vulnerability. And let's be real, nothing sells better than creating a sense of fear or helping create a problem and then jumping in and being the person that can swoop in with the hero as a magic pill or some magic solution, right? I see that so many times. And that's why I think this industry and kind of this sector of health and nutrition and functional medicine space is why we see so many industries and people out there straight up just kind of capitalizing on this sense of like fear and vulnerability. So I would say like some examples of like where has this conditioning come from? Number one, diet culture and fad diets, right? We see it all the time from like Weight Watchers and Noom and macro coaches, like all of these different diets out there that are claiming to hold some secret that you're missing, right? Some secret secret sauce, right? That you have no idea and only I hold the power. So we kind of see it a lot in more of a diet culture sense, where we get that kind of sense of fear and vulnerability instilled in us, and this feeling like we have to outsource this outside of ourselves, right? When we know that health is really an inside job, which we'll talk about today. I think another place I see a lot of this come into play too, in people getting kind of taken advantage of or getting a little bit of like an ick factor, is with your like MLM kind of product offerings and supplements. Again, I don't really need to name any names or brands here. You guys know exactly who I'm talking about when you hear like MLM schemes. But it's really individuals that are promoting a lot of like fat burners and fat burning supplements and skinny drops and appetite suppressing shakes and juice cleanses, and all of these things is just a huge amount of, like I said, we get that conditioning to think that like that's the answer, that's the focus, right? I also see this a lot, like I said, kind of in that mode that we've been conditioned to believe that something outside of ourselves is what kind of like heals us. Think about like the pharmaceutical industry, right? I mean, that is just laced with thinking that like, oh, your healing is somehow outsourced outside of yourself. Like you need this medication and somehow you're healthier now for being on this medication, right? You're being on this pill or being on this injection. Like it's like that somehow creates health. And it's like, that's interesting that we've been so conditioned to think that a prescription medication somehow makes us healthier. It's like there's not one single prescription medication in the entire world. There's not one single supplement in the entire world that heals anything. It can help us manage symptoms. It can help reduce symptoms, but it's not in any way, shape, or form healing anything on its own, right? So always nice to kind of know and question like where some of our like conditioning comes in. I also see this a lot in more of what I would call like greenwashed kind of holistic medicine, where people are spending thousands of dollars on things like genetic testing and IV treatments and med spas and HRT clinics. And like the worst of all is they kind of try to tote themselves as like au natural, right? And that's like their reputation, when in really they're just the same like pill for every ill conventional medicine model, right? And so I think that's kind of the trickiest one, is like trying to discern between like what truly is like a root cause medicine approach versus what are some other things that may be like super helpful bridge products, right? Like I'm not anti anything. I'm not anti any tool out there can be part of someone's plan, and I utilize as many as I possibly can. It's just a matter of recognizing like, oh, so that's just a bridge. That's something that I can use in conjunction with or while I'm working on finding the root cause solution. I'm like, yes, absolutely we can. Like there are certain supplements that even I recommend to individuals, but it's a bridge to get us to where we need to be. It's not the thing, right? Or maybe there is a particular nutrition strategy or a particular diet that can be a helpful bridge, right? But even when you look at the world of like functional medicine, how many times do people say like, oh, I got put on this AIP autoimmune protocol diet with all these severe restrictions. I'm like, I guarantee you that diet is not healing your autoimmune patterns. I'm like, it doesn't do that. Or, oh, I've had plenty of people that come in and they're like, oh yeah, my practitioner put me on an anti-candida diet. I'm like, that's fine to help alleviate symptoms, but like that's not fixing your problem, right? Or an antihistamine diet, right? Or, oh, I got told I had Hashimoto's, so I went gluten-free. I'm like, I'm telling you, like the diet is not fixing the root cause of any of those things, right? So diets can be a bridge solution, supplements can be a bridge solution, prescriptions can be a bridge solution. Like all of these things are super, super helpful. And like I said, we're not like pushing any tools out as a potential part of the overall strategy. And some people straight up are just looking for these bridge tools. They aren't really interested in looking at like, oh, why did I develop that autoimmune pattern? Or why am I struggling with weight loss resistance? Or why am I struggling with chronic gut health issues? They just want more of like, a quick fix, more of a Band-Aid solution, just make the symptom go away and I'll just kick the can down the road and I'll just deal with it. I know that the problem will continue to get bigger. I realize that because I'm not dealing with anything, but right now I just want the symptom relief. And that's fine. I always say, I'm like, you do you, boo. That's totally fine. But for individuals that are like, no, I feel like I've just been giving nothing but been given nothing but these bridge solutions. And like, I'm not about this revolving door of just continuing to deal with health issue. I have to after health issue or symptom after symptom. I want someone that's going to really help me like have a frank discussion of like, what is the root cause going on here, right? So I see way too many people that are like genuinely interested in improving their health the right way, and those that are absolutely exhausted of just the series of overhyped quick fixes and they feel like they're kind of getting duped. They feel like they're getting taken advantage of and downright honestly kind of scammed out of energy and time and monetary investments like in this more like functional or holistic health space even. And I am just not here for it, right? If somebody wants more of the quick fix piece, that's great. That's awesome. I probably won't be a great match for you from a provider perspective, but there are providers out there that will absolutely help dish you out a whole ton of different quick fixes. But I'm someone that's really here to help someone get to the root cause. Like we'll use bridge solutions. We're going to use nutritional strategies and lifestyle tools or supplemental strategies. We're going to use things to help you feel better as soon as possible. But we're also going to be like putting in the work. Like there's a reason why these patterns have developed, and we're going to get to the root of it. So that's where really I think today's inspiration for our conversation came from, is to have kind of like a really honest conversation about like what I do with the lowdown as defined, or like how the lowdown kind of defines functional medicine, and what you can kind of like be on the lookout for when you're searching for the right practitioner that kind of aligns to your values, right? So when I think of like the lowdown definition of what I would consider functional medicine, it is going to maybe even look different than some other practitioners that claim to be like, oh, a functional wellness practice, and like we do like B12 Botox and testosterone. I'm like, that's cool, but that's not my definition of functional medicine. I'm like, you're not helping anybody get to the root problem of anything, right? It's just like, come in weekly for your injection. I'm like, red flag number one is like, so I have to just come in like weekly? Like what's the catch? Like where does the treatment stop? Where does my like health and healing and responsibility kind of kick in and move forward, right? So when I talk about the lowdown definition of functional medicine, I think for our conversation today, I just wanted to make it easy. So I kind of broke it out into three main categories, right? So when you're kind of thinking about like true root cause medicine, or if you're somebody that's really looking for or connecting with that kind of approach, I think the three main categories I like to have people feel really strongly educated about the differences, so that you can really kind of, I don't know, I can't say shop around, but like find the best fit, right? So category number one is going to be testing practices. Category number two is going to be different modalities and tools that practitioner might use after we do testing. Like whatever we find in testing, what are the different modalities and tools that they call upon to help as part of their treatment plan? And then the third category is going to be expectations and support, right? So I kind of put it into three main categories so that you guys can kind of follow along a little bit and start to see whether there are things that are very valuable to you as a patient. And you're like, oh yeah, that's a high value item for me when I'm seeking out my healthcare team and kind of building my healthcare team. I definitely want those types of attributes in somebody that I'm working with. It's like perfect. And then there might be other attributes that you're like, yeah, there's other things that are more important than others to me. Perfect. Everybody can kind of define their own kind of key ideal practitioner or practitioner team, right? So let's just start with testing practices. I think this is what you'll see that will set a lot of different practitioners apart, a lot of different programs or a lot of different kind of companies apart, is what do they do for testing? My overall theme when it comes to testing for me is investigate and identify the root causes and not just Band-Aid or treat somebody's symptoms, right? So what I mean by that is a lot of times, and you might have seen this, where there's certain practitioners, they might draw some lab work and then they're going to treat a number on a lab, right? They're going to look at like, oh, your vitamin D level is low. Here's vitamin D, right? And it's like, I'm not really thinking that way. I'm like, okay, your vitamin D level is low. Why? It's a fat soluble vitamin. Are we struggling with fat malabsorption, which then is going to play into your immune system function and yada, 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 right? So I'm not going to just mega dose someone on vitamin D just to treat a number on a lab, but they don't even feel any better, right? We talked about that last week when we talked about nutrient deficiencies. Same thing when you look at like, I don't know, someone's like cortisol levels, right? And they're like, oh, here you go. Here's a catechol calm supplement for your cortisol levels. And it's like, okay, but like why are their cortisol levels high? That supplement's not going to do anything if you don't actually like dig into and treat the root cause reason. Like anybody, I can make your cortisol look lower on a lab, but you don't feel any different. I'm like, you're not any healthier by doing that, right? Or very similar to like a statin, right? I could go on and on of like, oh, you have high cholesterol, here's a statin. We can lower somebody's cholesterol on a lab, but they're not any healthier. They don't feel better just because we lowered their cholesterol, right? It's like it's such a bigger system and we can't just spot treat a number on a lab. So when it comes to the first category of testing, my biggest theme that I'm passionate about is aligning myself with practitioners. Even when I'm developing my own practitioner team, is like, who's going to help me investigate and identify the root cause of what I'm dealing with? So I always start with blood work. I think that that is very important. I feel like it's very much kind of shared, like a shared standard across both conventional medicine and functional medicine, kind of should share that standard of starting with some comprehensive blood work. But unfortunately, I have seen more and more patients like making an appointment with their doctor for symptoms like fatigue, hair loss, weight loss resistance, digestive issues, anxiety, and they don't even get labs run before getting out like the prescription pad, right? And it's like, oh, you're here for anxiety, here's this. It's like, we didn't even run labs. I'm like, that's kind of odd, right? There could be 15 different reasons why someone presents with anxiety. Like, aren't you going to treat like the right reason, or just like blanket with an anti-anxiety medication? So I wish I could say that I felt like starting with blood work was like, oh, that's standard and shared practice across all healthcare. But honestly, I don't think it always is, which is unfortunate. So maybe you did get blood work from your practitioner. Yay. Now you want to ask the following. Did you get like a full metabolic, hormone, and nutrient panel? If you're unsure, you can go to my link in my Instagram bio, and you can always download my guide to requesting comprehensive hormone labs. And there's a full guide on there that talks about like what you should have, what you should be looking at, what your practitioner should be ordering, what I order as far as my functional wellness consult lab. And you can also revisit the last 4 weeks of this Learn with Flo series, where I dove into exactly what constitutes like a full lab panel, and what I include for all of my patients as part of the onboarding process in my functional wellness consult. So number one, you want to, like, if you did get blood work, ask the question, like, did I get a full panel, or did I just get like a smattering of some random numbers? And number two, if you did get a panel, did you get an in-depth interpretation of what the results were looking like from not just like a diagnostic range, but like an optimal range perspective? Not just like a quick phone call or like a portal message that came through that says like, yep, ship shape, labs look normal. But like a full in-depth interpretation of what we're seeing, where are things like trending towards out of range, where are things out of range, and are we kind of starting to put the pieces of the puzzle together for this situation, right? So if you can't confidently answer like yes to both of those questions, like I got a lab panel and it was a full comprehensive panel and I got a full in-depth interpretation, then you're probably not really getting like a true, someone that's really looking at like a true functional medicine workup, which is fine. I just always want people to understand that so that they don't feel like disempowered as a patient, right? It's like, if you didn't receive that, that's okay, then just look elsewhere, right? There's other practitioners that will help you dig into that. Like, you're not stuck with just that one doctor or that one interpretation. some people, like I said too, that's what they're looking for. It's totally fine. If you want to manage I call it like, some people like to kind of manage their health through like a series of unfortunate events that like gradually get them put on like more and more medications. That's totally fine. Like, you do you. That's just not me. I like to catch that way more proactively, or I like to look at and say like, okay, why are we on all of these separate supplements? Why are we on all these separate medications? Like, what are we missing? What's the root cause here that we're really missing? So number one is definitely starting with blood work when it comes to testing. Number two is at least having the opportunity to dig in with more functional labs. So depending on somebody's health history, their current symptoms, what we see in blood work, you should at least be offered the option to discuss what blood work doesn't show very well. And there's probably three main categories that I would do additional testing with for individuals, depending on what we see, because blood work doesn't show us a lot, right? It can show us some things, right? We can see thyroid panels, we can see lipid panels, we can see blood sugar markers, we can see some nutrient status markers, but it doesn't show us everything. So if I suspect that somebody maybe is having some more in-depth like hormonal imbalances, or how their body is metabolizing or excreting hormones, that is a perfect opportunity to do some more in-depth functional lab testing through maybe something like some urinary metabolites with like a Dutch panel, especially if we're dealing with like menstrual cycle symptoms, fertility issues, peri or post-menopause. Like, we might need more in-depth than what blood work can show. Or individuals definitely that are showing digestion or detox issues. Sorry, but we cannot see much about gut health in the blood. So if you're going to your doctor for gut issues and they're drawing blood work, like, probably isn't going to be super helpful, right? If you're struggling with like GI symptoms or like mood changes, skin issues, autoimmune patterns, like, we'll definitely want to dig in with more functional gut testing or some stool analysis there. And then the third category that blood work doesn't really show is like a toxin burden. For certain individuals, like, we're not going to see that on blood work, right? Because our body stores our toxins in like fat cells and also very much in tissues so that it can't cause any issues. And so if we suspect that somebody has any sort of toxin burden, whether it's like mold or mycotoxin, heavy metal overburden, like, we really want to see that on additional testing outside of blood work, right? So I do not recommend all of these tests for everybody by any means at all. That's absurd. And so there's another red flag, like, do not get duped by that. But you should at least know that these options exist for you, like, as an empowered patient. That's really my biggest thing, is I don't want somebody to feel tied to or limited to only being able to test like what their doctor orders or what their insurance will cover, right? It's like, there's so many more things that can be impactful for the overall health journey, way outside of just traditional blood work. So as like an overall theme under testing, like, looking for someone that's helping you investigate and identify root causes. Like, are they starting with blood work? Are you getting a full comprehensive metabolic and nutrient status panel? Are you getting a full like optimal interpretation of that, and having the opportunity also to think about other functional tests that could uncover some more root cause approaches for you? So red flags would be either not getting options to do a lot of that, or like the only option is to do like all of that and feeling like you have to dump like thousands of dollars into testing up front. Like, I think that's a big red flag too, right? So when we think about testing, then we kind of get all of these testing modalities or testing data, and then we can take it into like a treatment strategy or a treatment modality. So category number 2 that I wanted to kind of dive into was talking about, from a functional medicine perspective, what are some of the different things that I use as part of a treatment plan, depending on what we see in the testing, right? So the theme here of our modality and tools is going to be tapping into your body's self-healing systems. This will make sense in a second, but really what we want to think about is a few different things when it comes to like modalities and tools, right? Number one, regardless of whatever testing we decide to order or not order, are we digging into a proper, what I call, order of operations? right? So when we're looking at this, we have these testing practices that we get to test so many different things, right? We can look at blood work, we can look at urinary analysis, we can look at stool samples, we can look at toxin burden, we can look at all of this data, yes, but it still takes a skilled practitioner to understand that like all of this data is from one person and from one body, right? And if there's one person and one body, then we have to put Humpty Dumpty back together again, and we have to treat this in the right order of operations, right? So we have to understand, like, I think a really key sign is a practitioner that has like a plan that's helping you peel back the layers like an onion, right? Like one layer at a time. One thing is going to build on the next. I like to call it with my patients our domino effect. Where are we going to start? It's not going to be one thing. It's never one thing. But I'm like, where do we need to start? We're going to tip our dominoes off there. How far can I get the dominoes to spread with just that piece of the puzzle? Right? It's like, oh, what's my lowest hanging fruit? What's the biggest foundation piece here? How far can I get that impact to spread? Then we can pick up where the dominoes stop falling, right? And like, tip them over again, right? So there's going to be a proper order of operations. And like I said, from a skilled practitioner perspective, they should understand that kind of order of operations of how do we want to drip and support, not like drinking from a fire hose, but also, like I said, not just treating symptoms on a lab or treating numbers, but it's like a very strategic order of operations. So I feel like a good skilled practitioner should be able to outline what that domino effect is going to be for you with kind of a careful consideration of the body's natural healing hierarchy. So let me just take as an example. Say we know we have some hormonal imbalances, right? We have some menstrual cycle issues. Maybe we have some fibroids developing. Maybe we have some super heavy cycles. We have some cyclical acne and cyclical migraines going on, whatever. We know there's some hormonal imbalances going on, right? We know that when it comes to hormonal imbalances, like that's not the root cause, right? It's like, ooh, okay, that's interesting. We have to understand like what first dominoes are going to get us to the hormone imbalances, right? So we can't start with hormone imbalances and be like, oh, here's some more hormones for your hormone imbalances. It's like, no, let's also understand that maybe we can use some of that as a bridge tool, sure. But what about addressing things like blood sugar? Then we need to address cortisol. And by then we need to address gut issues and liver health and drainage and detox support. Like all of those are the root causes of your hormone imbalances. So I'm not saying that we can't use like some hormonal support as a bridge solution, but that's not the end all be all, which is why, like I said, I have that conversation with women that are like, on birth control, for example. I'm like, yes, that will alleviate your symptoms, but, and I'm not saying our anti-birth control, like we are going to need to like regulate cycles here a little bit, but that's not the fix, right? We can have that on board while we're working on the root cause, right? And then we can slowly peel back that bridge so that you don't have to be on the birth control for these symptoms, right? So it works that way with any sort of hormone replacement, hormone support, is using it as, like I said, a bridge solution while we dig on and support some of the underlying layers that contribute to that picture. So domino effect, order of operations should be really key. And then as part of the order of operations, we want to start to bring in things that I call are your self-healing tools or your self-healing modalities. So let me make it super clear that it's a huge red flag for me if your plan starts with supplements or medication. To me, the plan should be more surrounded around like, okay, are we coming in with a strong strategy of the foundations first, right? Those are going to get us the biggest domino effect payoff. They're the lowest risk, highest reward. They're usually so we can kind of see that happening very carefully as well too. So first and foremost, custom nutrition programming, when, how, what you're eating according to your metabolic phenotype that we found out through lab testing. This plan will evolve as you go too, right? It's not like one diet and you're married to that forever. huge red flag, right? It's like we might use some healing diets on the front end, but the goal should be that that person helps you reintroduce all of those foods back in again, right? Like we're not on some like restrictive diet or elimination diet forever. We also need to make sure that that plan is very heavy in like lifestyle programming, whether that's movement, sleep, hydration. Also, definitely a huge part of my treatment plans, which isn't confident for every practitioner. I get that, but something that I feel like is a difference maker in my successes that I get with individuals is the willingness to go into the mind-body medicine piece, nervous system tools, uncovering limiting beliefs, setting boundaries, adopting a routine that allows for healing, right? All of those types of things. And then as a non-prescribing practitioner, I lean a lot into a lot of the nutraceutical supplementation as well too, right? So it's not that I'm just like doing testing, putting someone on these 1,000,001 supplements and sending them on their way. It's like huge red flag. I'm like, that's not fixing anything. That's no different than a doctor running a lab panel, putting you on a bunch of prescription medications and sending you on your way. It is no different. It's the same exact thing, right? So I would say like some major red flags that I always kind of identify is if your practitioner does not start with a food forward nutrition foundations, like eating enough, balancing blood sugar, replacing nutrient deficiencies, like food forward first, like red flag, right? That should always be like number one. Red flag is also if your practitioner is kind of like marrying you to some elimination diet forever. I wouldn't. Your practitioner didn't address things like sleep or stress. Big red flag. Your practitioner ran a ton of tests and only recommended like supplements, medications, or elimination diets. Red flag. Or if you're finding that your practitioner is putting you on more medications and more supplements because of the side effects of other medications or supplements, right? It's like you can kind of see this before. I was actually just working with a patient today where she had some mood changes and energy imbalances, right? So she sought out some hormone support. And so she was working with some bioidentical testosterone support. Great, awesome. She was feeling better, amazing. But then she started to notice that her thyroid levels were off and weird. So then that same provider like put her on thyroid medications, and she never had thyroid problems like before. And then a few months later, she started to develop like some chin, like acne and more breakouts like around her body. So then she got put on spirulactone. And so you can see, I'm like, wait a second, like she came in with like low energy, low libido issues, and now we went testosterone, now we're on thyroid medications, now we're on spirulactone. I'm like, we're just like using medications to cover up the side effects of the other medications and creating problems that weren't there before. I'm like, are we really moving forward? I'm like, I don't feel like we're really moving forward. I feel like we're kind of just like in this spinning cycle standstill, right? So it's one of those things where if you notice that is just kind of like this addition game because of some of the side effects, that to me is also red flag, right? So now that we've kind of talked about like, to me, like testing factors that should be part of a functional medicine practice and more of the modalities and the treatment tools, really starting from a food forward standpoint, looping in lifestyle and behavioral approaches, mind body medicine, right? All of those things like before we talk about potential like bridge solutions. That to me feels like what root cause medicine is all about. I'll wrap up thinking about the third category here, which I call expectations and support. So this can look a bunch of different ways, but when I think of expectations and support is like, okay, what's the ongoing relationship between you and that practitioner? Like after you've done a lot of like testing or some like initial planning around your progress, right? So to me, the theme is like, is there an ongoing relationship that develops independently driven change? What I mean by that is like my goal as a provider, something that's super important to me is that yes, I'm going to take people on, I'm going to take them under my wing and I'm going to give them a high level of support, but my goal is that they fly on their own. Like, that's my whole goal. Like, I'm building you up. I'm giving you education and tools and knowledge about your body so that you can take that and like fly, bird, fly, right? Like, that's my ultimate goal. So when I think about expectations and support of a practitioner that's practicing more of this like root cause medicine, they're acting as the guide, right? They have the GPS, but like you as the patient are ultimately the driver. So they're really empowering you with different tools that you then take and own a high level of personal responsibility in creating that change. So it's not going to be one thing. It's like multiple things are going to be addressed over a longer term relationship. So it's not going to be a 30-day transformation or a quick fix. It's just not, and that's okay. The beauty is in the journey. It's not even in the destination of it, right? And so it's going to be work. It's going to be change. And throughout that, it's going to require you to kind of take a look at your life and kind of audit like, ooh, what's working and what's not working from a nutritional standpoint, from a lifestyle standpoint, from a boundaries, from a stress management, from a nervous system tools. Like, I'm going to require some like personal responsibility here, right? For what the reality is and the outcome to my reality. So it's always comes back to being able to like truly empower the patient with education and support, but it's really like the ultimate goal of the patient to really own that, which is really cool, versus I would say more of the like allopathic or traditional medicine experience is very much like provider driven when it should be the patient in the driver's seat. The patient's in the driver's seat. Practitioner is just the guide and not, like I said, the practitioner making the decisions on behalf of the patient, right? I'm like, that seems like a mismatched balance because it's ultimately like the patient should feel really good about what they're committing to and not like what their doctor just told them to do. I'm like, that usually never creates any sort of empowered or long-lasting change, right? So I think a great provider-patient relationship is something to where the patient comes in and is like, I am so excited to give somebody or to work with somebody that has a GPS system, right? I can't see where I need to go. I know where I need to get to. I know where I would like to get to. I just don't know the twists and the turns of how to get there. So I'd love to be able to bring somebody on my team to help me who has the GPS and can guide me there. But ultimately, like, I'm the driver. I'm going to do that, right? And I just think that creates so much more than freedom in the future to be able to take that GPS then and be like, fly, bird, fly. You got it. You learned how to navigate. This is great. And so just know that from, like I said, a functional medicine perspective, there's a lot of different, what I would call dupes out there. There's lots of different people that are trying to kind of capitalize and monetize on this space because people are getting more fluent in talking about their health and learning about their health, which I love. That is amazing. But because of that, there's also a lot of people creating a lot of unnecessary like fear and really capitalizing on someone in a very vulnerable state of their health and looking for answers, looking for help, and kind of dangling this really shiny carrot, dangling this really shiny diet, dangling this really shiny supplement, dangling this new fancy dancy injection, or like whatever it is. And it's like, all of those things could be potential tools. Like, I look at all of those out there and I'm like, yeah, for the right person, maybe so. But we just want to recognize like, a tool isn't the whole toolbox, right? Very rarely are we going to get the job done with one tool. And chances are we might like make some cosmetic fixes on the outside, but like it's still a disaster waiting to happen on the inside, right? So that's where I think if you really are looking at like, what is root cause medicine? What is functional medicine? What does it mean to do that? It's a provider that's really understanding root cause testing and being willing to go like to comprehensive blood work, but even being able to go beyond blood work to help somebody get to their success. It's also then taking the data and looping in other modalities that aren't just supplements and medications, right? We're looping in other things that are medicine that aren't found in a bottle. right? It's like that's where the root cause healing really comes into play. And then also a practitioner that is willing to be your GPS guide, but allow you to stay in the driver's seat of that and really owning a huge part of that journey, while also feeling the support and the guidance of somebody helping you get there in the most effective way possible without spinning your wheels, wasting your time, or wasting your investment resources on something that's just another quick fix. Right? So if I had to kind of, like I said, summarize everything, it would be the last 90 seconds of everything that I just said. And hopefully that kind of helps you guys out there as you're navigating, start to kind of put your antennas up a little bit over something that might feel like a little bit of a red flag in more of the functional health space. So hopefully this was helpful for you guys. If you have any questions, drop them below. And we will be back next week with more Learn with Flo.